Hello, Dr. Aki again. I introduced you to the laser touch, the Dr. Aki laser touch one earlier. And if you hear any car horns and things like that, it's very authentic. This is Indonesia. I am here with my friend Adi, and he has volunteered so I can demonstrate on him how to treat different body parts. And the first thing I usually do before I start treating, I use an alcohol swab to clean the tip. I do this before and after treatments, and in many cases we call it a demo. Essentially is to show how to use this. Now again, I mentioned the electrolyte gel that I use. I usually put it right on the tip, and before I'm going to treat his neck and back, because back pain is probably the most common type of pain that we see. Second to that are headaches, upper back shoulder pain, there's arm pains, there's carpal tunnel syndrome, there's various different type of pains that we will talk about. I can't cover them all right now, but if you see on this little chart here, I don't know if the camera can pick that up. Can you see that? See this? You can see all these different muscles in the back. On this side is the superficial layer. Here, the superficial layer is cut away, and you see another layer and another layer underneath it. And in most parts of the body, there are about 4 layers of muscles, but in the lower neck and the lower back, there are more than 4 layers. So, in essence, when you treat, you can't expect to penetrate all layers at once. And very often you have to take multiple treatments to get through all of them, but eventually you will get through all of them. So in this case, I'm going to demonstrate how we're going to treat this neck and upper back first. And if you can picture the muscle coming out from here to the shoulder, down to about mid-back here, up like that. And so when I start treatment, I usually do a little test first on his hand. So I'm going to walk around. And since he's got his back to you, this is the area where I usually stimulate that. So now the laser is on, but the electricity is off. And I'm going to put it right there, spread the gel a little bit, hold still. Adi, tell me when you start feeling it. Feel it light, feel it now? Oh, yeah, see how he reacted? So that was a little more than he wanted. How's it now? Still strong? Is it okay now? Yeah, okay. And then that's the level. I don't readjust it. And so I start with some gel and I spread. How's the current, by the way? Is it okay? Is it strong? Well strong? Okay. So I always ask for the patient or the client how it is, whether the pressure is okay or the current is okay, because you can always adjust that. Now as you can see, I'm using a very liberal stroking technique called the painting technique, and as you can see, I work pretty fast. And the reason is that the nervous system transmits information at 286 miles a second, so that's pretty fast. I can't beat that with my hand. But what I found is that I can still get a tremendous effect in the tissues. Now, the camera, if you need to take a close-up, because something is happening here, as you can see. And all the regions where I'm treating, there's some red areas coming up. And that's usually an indication that underneath, tissue is tight. So for instance, here is an area that is a little red. Is that sensitive at all? A little. Little, okay. You use the computer a lot?
Yes.
Okay. This is typically what I call the mouse muscle. So if you do a lot of mousing, this area here usually gets irritated. Can you do me a favor and cross your arms across your chest? And grab your shoulders. Okay. Good, both sides, and relax your shoulders. And I don't know if you picked that up, but the shoulder blades just moved out of the way. And the reason is that these muscles here called the rhomboids that attach at the spine and the shoulder blade are the ones that oftentimes have knots, like right here. And tell me if I hit a spot that's sensitive. Right here? That tender?
Yeah.
Yeah?
Oh,
yeah. Yeah? You feel that, huh?
I can feel.
Alright, here's another one.
Yeah, that's one.
Yeah. Do you hear? He's actually responding to it. He's got quite a few knots. And you've not had any pain at all? Any?
I feel it just now.
Just now?
Yeah.
And before this you weren't aware of it?
No.
So here's a healthy young man who does a lot of computer work, who is not aware of pain, and yet I find all these spots here that are normal. So, you know, he potentially, if he didn't take care of this down the road, would have all kinds of problems. Now, I've only treated one side deliberately, his right side, and I want you to relax that, and I want you to just turn your head side to side, looking over your shoulders, and then the other side, and tell me if you feel a difference on this side versus the other side.
A little bit.
A little looser?
Yeah, a little looser.
Do you feel any spots at all when you turn in your neck? Anything tight?
Not quite.
Not quite. How's the left side feel compared to this? Is it a little tighter or not much difference?
Not much difference.
Now he's a pretty healthy person, and somebody with neck and back pain, you oftentimes will see that they have a definite difference after one treatment. Okay? If you want to roll your shoulder and move your arm and see how that feels over here. How's that feel?
Much better.
Much better on this side. Now, if you notice that redness here was an area where he had a lot of what we call trigger points, even though he wasn't aware of it, but these are problem areas. And of course, you also want to make sure that you treat both sides. So the switch stays on for 2 minutes at a time, and I treated his right side for about 2 minutes, so it doesn't take very long. And I'll probably do about 2 minutes on this side also. You want to cross your arms again. How's this side compared to the other side?
I feel something.
Right?
I feel something.
Is it as sore as the other side or less? Or the same?
Kind of the same.
Same, huh? And
Yeah.
see again the redness. So, oftentimes people tell me that they don't have any anatomy background or knowledge. Well, as you can see, by using the device, you really don't need a lot of knowledge. Just know where the pain is or know where to you know, find the pain. And again, it's very, very red. Can you relax this now? And then turn your head again side to side. Move your arms and shoulders. How's that feel? Pretty good?
Yeah, pretty good.
Do you feel anything on that left side still? No soreness?
Not much, but when you do the treatment, the left side actually feels more than the right side.
Oh, really? So that felt worse than this side?
Yeah, kinda.
Huh, interesting. Well, I don't know if you can see, but do you think that's redder than this side? It is, huh? Isn't it? Amazing. So he tells me that felt worse, and the redness kind of agreed with it. That's area's worse. So let me just wipe this off. As you can see, we have our own special towel here. Okay, now let me go on and show how we treat the lower back.